I'm Jay Rabinowitz, the senior pediatrician at Parker Pediatrics, and this is Lindsey Einhorn, who's our senior psychologist at Parker Pediatrics. Parker Pediatrics has been in Parker for over 30 years. We're a very innovative group. At least for 20 years, we've had a psychologist as an independent contractor for a long time doing ADHD evaluations because they do them much better than we do. But about 5 years ago, we just got tired of all the hassles of referring out, never hearing if a patient leaves, not getting follow-up, having to deal with all the problems anyway because you can't find child psychiatrists most of the time. So we took the bull by the horns and said, let's hire our own psychologist. And we did, and now we have 3 psychologists that are employed by us. So these are our own employees. And we have a great integrative system. Before we even knew what the word integrative meant, we were doing it. So let me tell you briefly about our grant project. Do I turn this or is this? There it goes. We had 4 parts to our grant. The first was to expand behavioral health care services to patients having Medicaid coverage. We were unable to see, we have about 15% Medicaid, and we weren't able to include them as part of our integrative care because, quite frankly, we weren't getting reimbursed to do it, and it was such a major hassle to do. All the other insurance plans were on board, but Medicaid was hard to deal with. So now we're able to, as of September 1st, bring in our Medicaid patients too. Secondly, we're going to train our psychologists to screen and use brief treatments for substance abuse and abuse. We're presently doing that. We hope to be able to start that by January 1st of next year. Third, we're going to explore the feasibility and efficiency of expanding our electronic health records. Well, we did that already. And it turns out that anybody my age knows this. It's much more efficient to use paper. So, and even Lindsey, who's trained on computers, agrees. It's much more easier to use paper. So what they do, is they use, and we did a survey on this, and we timed it and the whole deal. And during the sessions, they use paper, they finish up their notes, and that's scanned into our electronic record, and it just works a lot easier than spending days typing up every report. So we're very comfortable with what we're doing there.
I have to read our handwriting.
We do it, but remember, they're PhDs, not MDs, so we can read their handwriting. They can't read ours. Finally, we want to continue with our existing program of evaluating our projects and measuring the outcomes of our proposed projects. Since we were fairly new to this and we were one of the first, we wanted to do statistics right from the get-go to show people that what we're doing is working. And we have a lot of statistics right from when we started this 5 years ago. And we've hired an analyst to be able to continue to help us do this so we can present our data. And Lindsey's going to tell us about some of that right now.
Yes, hi everyone. So I wanted to share a little bit about how our patients, as well as our medical providers, are viewing the mental health services that we've been providing. So anecdotally, for years, we've been told by our patients and our providers that they really appreciate our services and that they're really happy that they're able to access mental health services within their medical setting. But we had started collecting data and we thought that it would just be a good idea to get more quantitative information to guide some of the work that we're doing. So we developed a brief measure that assessed some different questions to ask the different patients. And we set aside a couple of days in our office where we said that every patient that walked through the door was going to get a survey. And I imagine every year we'll continue to do this to get an additional samples. But every patient that walked through the door those couple of days filled out a survey. So as you can imagine, that included some patients that have received mental health services at our practice in the past, as well as some patients that are currently receiving mental health services. And then it also included some of our medical patients that had never seen our psychologists. And so for our patients that were current mental health or past mental health patients, they received a set of questions that they had to answer. Some of these questions included how important is it to you to receive mental health services at this medical setting? How convenient is it for you to receive mental health services in this medical setting? How satisfied have you been with the services? How much has your child benefited? How much has your family benefited? So those are the types of questions that we had asked them. We asked them to rate it on a 5-point scale, with 5 being very satisfied, very convenient, very important, and 1 being not very satisfied, not very important, not very convenient. On the convenience factor, the patients at the average rating was a 4.5, so viewing that receiving services within the medical setting was extremely convenient. On all of the other questions, their ratings range from a 4.1 to a 4.2. So again, patients on a whole reporting satisfied to very satisfied, important to very important on all of the different factors that we looked at. When we looked at the different questionnaires, we also learned when patients were writing in some different information that they really do value being able to get this service within their medical environment. They just have this inherent comfort that they trust their medical doctor. They've typically been coming here since they're infants, and that if their medical doctor hired these psychologists, well, then they should inherently trust the psychologists. They also reported that they really like seeing their medical doctors when they're walking in the hallway. They also like knowing that where there's communication between the psychologist and the medical doctor. So on a whole, they provided us with lots of really great information that validated what we were thinking about the services we were providing. And then for the patients that were medical patients that had never seen the psychologist, they were asked, did you even know that we had this service? And 62% of our patients reported that they knew that we did have a psychologist. So a decent amount, but there's also a decent amount that had no idea that we provide mental health services within our office. They were also asked if your medical doctor referred you to the psychologist, would you be interested in this type of service? And 90% of them said that they would be interested. 90% said that they also would access care within our medical office and that they didn't see any barriers that would get in the way of receiving mental health care in this fashion. So all good news. I think we learned from that we still need to educate the rest of the population that we see, that a lot of them don't necessarily know the services we're providing. And then in terms of our medical doctors, our medical providers, they seem to really also appreciate the services that we provide. There's lots of communication. There's indirect and direct communication between the psychologists and the medical doctors. Sometimes it's just you're walking in the office and you're walking past them and you have a question about a patient, so you just stop them in the hall and you get to have some communication in that way. Other times it's more of a sit down, we really need to talk about this complicated patient, and we do that. Once a month we also have a meeting where all the medical doctors and psychologists are attending, and so we're able to communicate at that meeting as well. And then one of the most valuable access that we have is just the charting. And so the psychologists as well as the medical doctors have access to each other's charting. And as Jay had mentioned, ours is written and theirs is electronic, but it's all accessible via electronic medical records. So that's nice. And so if a medical doctor refers a patient to psychology, you can read through the medical chart and find out exactly why they're coming, what the medical doctor's concerns are, and what we need to address. And likewise, if we refer someone back to them for a medication consult or anything else, they're able to see all of the psych notes. So that's a huge benefit. The other thing that the medical doctors have reported is that they just feel like they could be a better doctor having psychologists on staff, that instead of just focusing on the patient's medical needs, they really do focus on the patient as a whole. They focus on their medical needs, but also their psychological needs, emotional needs, behavioral needs, and so it does seem to provide more of a comprehensive care to all of our patients. She's wondering, for our second bullet point, so the 62% of patients know about our services, how are we going to inform the other patients? It's a great point, because we do have newsletters, we have a website, so all of these things are up on the website and up in our newsletters. However, if people don't look at them, then it doesn't really matter. So I know most people find out about our services either that way, or if they're in for a medical appointment and they're struggling, and then the medical doctor tells them about it.
I think another point about that is, since many of our patients are just babies, first-time moms, and the kids are only 6 months old, 1-year-old, they're not really thinking mental health yet, unless they have postpartum depression. But other than that, I think it's just not in their ballpark yet of even getting into that. So a lot of our patients are under 5, under 4, under 3, and they're just not there yet.